Today I want to talk about how, as Secretary of Health, once appointed, how I would make science come back to our actual health. You see, one of the first things I would do is work with whoever is Attorney General under Adam Calhoun's administration, and I'd work with them to find out why we turned science off in 2020 and who benefited. You see, we've known for a long time that asymptomatic transmission of viruses is extremely rare. Dr. Fauci even said this.
But the one thing historically people need to realize, that even if there is some asymptomatic transmission, in all the history of respiratory-borne viruses of any type, asymptomatic transmission has never been the driver of outbreaks. The driver of outbreaks is always a symptomatic person. Even if there's a rare asymptomatic person that might transmit, an epidemic is not driven by asymptomatic carriers.
Back in 2013. And then, early in the pandemic, World Health officials said this.
What proportion of asymptomatic individuals actually transmit? So the way that we look at that is we look at, these individuals need to be followed carefully over the course of when they're detected and looking at secondary transmission. We have a number of reports from countries who are doing very detailed contact tracing. They're following asymptomatic cases, they're following contacts, and they're not finding secondary transmission onward. It's very rare. And much of that is not published in the literature. From the papers that are published, there's one that came out from Singapore, looking at a long-term care facility. There are some household transmission studies where you follow individuals over time and you look at the proportion of those that transmit onwards. We are constantly looking at this data, and we're trying to get more information from countries to truly answer this question. It still appears to be rare that an asymptomatic individual actually transmits onward.
Now, as Secretary of Health, I am not a doctor. I'm not a PhD. I am somebody that worked in healthcare for about 15 years. That's it. However, I'm going to bring common sense back, because if we knew all along that asymptomatic spread is a very rare thing, extremely rare thing, I would like to see the compelling data that made us change our minds on that. I would like to see the compelling data that made Dr. Fauci and World Health Organization members and the CDC members, I would like to see their rationale why the known science that asymptomatic spread of viruses is very rare. I would like to see the justification for the change in data, or the justification by seeing the change in data that made it so we literally shut a country down, our country, for asymptomatic spread. It doesn't seem to make sense to me. I am absolutely sure, because I'm not going to question past administrations and past health officials as Secretary of Health. I'm not going to question that they meant well. I'm not going to question their morality. I am going to question their intelligence and their common sense and their logic. Because if we have known for a long time that asymptomatic spread is very rare, I want to know, and I think that the American people should know, under a real administration of real Americans, not politicians, why in the hell politicians and pundits locked the country down based off of asymptomatic spread and masked people based off of asymptomatic spread, when, according to same said officials, even during the pandemic, asymptomatic spread is not an actual concern. So we would check to see what justification they had, and if there was lack of justification for the damage caused, of course people would be held legally accountable. Of course they would. If they made assumptions that teetotaled a country that were wrong, or against what they already knew without justification for it, just on their opinion, we of course would hold them liable under a real administration. God damn.